Hey guys, welcome back to my YouTube video channel. How you guys doing today? I have another presentation to share with you a case regarding to the gummy smile. So let's jump right in so I can share the slide and you can see the case and we can discuss about this case. Those of you who follow me knowing that I'm trying to share my experience and my skill of dentistry for you guys to learn, especially those starting to treat the braces. So this is a case where a patient came in with space in front of her smile, skeletal class 2, and having over jet intraorally. Patient have a lot of space over jet, as you can see more on this picture on the left side. A lot of you can see there's some identification of wear and tear of the deep bite due to the deep bite. The bottom teeth seem to be very nice and straight. On those, there is a minor discrepancy of the incisor edge. So when you look at this case like this, should be a straightforward case to finish the case. Patient was in his her late 20, and so just want to share another smile here. This is how she smile. You can see this considered a gummy smile. Have a little chip tube here, little grinding on the I would say parafunctional habitual habit causing the damage of the incisor enamel. These are critical information for you to see. You can see also on the profile of the patient, very sort of a classical African-American skeletal class 2 or Asian class 2 occlusion. Now, do you understand that nowadays the philosophy and also the trend that we trying to improve patient aesthetic, but minimize the result of compromise the physiology of the patient. That is called the minimizing the airway space. So typically back in the day, you see this patient, you automatically suggest the patient have upper first bicuspid extraction and pull the teeth back, give the patient nice profile. Yes, you can do that. But the problem is you look at the airway space, you're going to be compromised airway space. So nowadays we're trying to do we suggest the patient the option whether extraction and non-extraction. In this particular case, I explain to the patient the pro and con. Patient choose to not extract their teeth. So we start etching and bonding, start the case, and you can see that this is the first day, and then we several months later, the case start with increasing the wire on the top. The bottom tube is start aligning very quickly. This is after several months into braces, you will still seeking some gap there. So we need to use power change the elastic to pull the teeth together and trying to close the gap completely. But you can see that the bottom teeth is really nice and straight. And noted that I don't use any bracket. I'm sorry, the molar tube, which is basically molar band, which is basically a lot of compromise with the gum, especially for adults or even in children. So nowadays we can do things without damaging the gum or minimum invasive the gum with using the molar tube instead of molar band. And noted that I try a couple of times putting bracket on the crown, but it keep coming out, so I skip it. You have to work around the case, guys. Nothing is perfect for you. So here's again, this is the before with evidence of deep bite and parafunctional habit, this causing the damage of the incisor edge as well as the lingual surface of the tooth. Space on the bottom tube a little bit here and there, and super rotate a little bit of rotation of the lower central incisor. But as you can see, when case finishing up, you see quite straight and nice. You noted that also there is the issue with the space here. So we did end up close to the end of the treatment. A few months, we basically recommend the laser gingivectomy for the patient. And we did all of that to improve her smile. So this is before we start her laser, and this is after, right after. And you can see that this is before and this is after. So in this scenario, now, if typically when we identify that we just need to do the laser gingivectomy instead of crown lengthening, if we identify, because the reason of this is a pseudo pocket, not because of the compromise of the bony architecture causing the gum to like this. The other thing is patient have habit of smoking, so there is a problem of having the tube heal, the gum heal properly during orthodontist treatment and after laser. So this is the result after 6 weeks of taking off braces. It's not taking off the braces, but but done the laser. And this is the picture of the right after the treatment that we took out the bracket and we took the photo. And so I want to show you, this is before, this is during the treatment, and this is right after taking off braces. The case is not perfect. As you can see, the gum is still regrow a little bit, but this is because I mentioned to you, patient is a smoker. I encourage her to stop smoking and get back to hygiene and improve it. And so I will follow up with her case, but as you can see, there's a great improvement. This is again intraoral photo. The top first line is the before, during the treatment, and this is right after the brackets being removed. Again, this is on the before and this is after, everything straight. This is before and this is after and after right here on this side. Both of these are, and then this is the lower is before and this is after. You can see very straight teeth. Anyway, this is the final result. This is a comparison between profile before and this is after. Patient was very happy, and even though there is some more improvement to be done, but she was very happy. And so just want to share with you. If you have any questions, you feel free to let me know. Just want to share the case, and of course, during these type of presentation, there's a lot of things I might skip, miss out. My goal is to share to you guys as general dentist. You can do a lot to your patient, especially those of you who started your journey of dentistry. If the early you start in your career, the longer in the long term, you're going to see that the investment of your education right at the beginning of your dental career is very important. So pay attention to continue education class and take as much as you can, and you will love your career as you go along. I've been practicing for 20 years, and I've been doing braces for more than 12 years now. Really excited, and things getting better and better, as you can see, using the technology that we have from nighttime wire and Invisalign and Clear Correct aligner. So many things that being a general dentist or being a dentist nowadays, we are so blessed to have a chance to learn, to utilize the technology. So my prediction is in the future, in the next 5 to 20 years from now, there is so much change in dentistry that if we don't anticipate and if we don't try to update ourselves, the knowledge from the latest technology, we are going to be way behind. Doesn't matter what school you go into. You can go to the top school in the United States or top school in your country, but if you don't keep up with your education and continue learning the new stuff, you're going to be way behind. So that's my encouragement. Hope to this video help you guys, to encourage you guys to do things that beyond your uh, capacity, but you are learning and you are improving yourself, and you can take care of your patient better. Thank you for watching again. Have a great day, you guys.